Hello and welcome back to NK Fertility Solutions, where we talk everything pregnancy, fertility, and your holistic living backed by faith. So today I want us to objectively analyze this video. Wait, a nurse is boldly telling people, women specifically that are trying to get pregnant, to stop taking folic acid. And her reason is that, yes, that folic acid is not a fertility medication. Please follow me and let's listen to this video where we drag out the fertility truth in this video. And on the other hand, we equally have a pro doctor telling people, women specifically also, that are trying to get pregnant to please take their folic acid medication. So let's go with the nurse first.
You want to get pregnant naturally, like you won't get belle in 2 to 3 months time, pay attention to this video. Now, let me tell you something. Folic acid is not a fertility medication. Listen, I know say some of you now go won't talk papa, but let me tell you something you don't know. Folic acid is not a fertility medication.
All right. I believe you heard clearly what she said, that folic acid is not a fertility medication. Here is what I want you to know if you're a woman trying to conceive. Yes, generally speaking, science-backed. In fact, a whole lot of people know that, yes, folic acid can help to prevent birth defects, that's neural tube birth defects in children. Okay, but here is one thing again. Folic acid can actually equally help your blood cell production, your red blood cell production. It can equally help in regeneration, repair of your DNA. Girl, that proper DNA is where your egg quality really stands. It's one of the foundation of your egg quality, a good DNA, all right? And what if you're trying to get pregnant and you are already dealing with anemia, and you are prescribed with folic acid that is meant to work with ferrous sulfate, the iron supplement, the iron tablet, or the iron supplement? Will you say you will not take it? You will, because an anemic woman, you are going to struggle with poor egg quality, poor ovulation, irregular period, and difficulty getting pregnant. In fact, the last thing your body wants to do with anemic state is to allow you to get pregnant. It will not even try to do that. Another point I want us to look at is, rather than just outrightly saying that you don't need to take folic acid, I think it will be better recommended, because experts are now beginning to say you can take folic acid at least 400 mcg daily. But there is another form of folic acid that you can take. We have the methyl folate. That one is the most active form. When you take the folic acid, this particular one, this cheap one, okay, all over, even fortified in foods that people can easily access like that, that's folic acid specifically, without the methyl included there. When it gets to your body, it goes through lots and lots of conversion in the liver for the liver to produce the active form that the body will now use, okay? And sometimes that conversion depends on a lot of factors. That's when sometimes there is poor absorption. It will now look as if it's as good as you did not take it, okay? So rather than stopping the folic acid, you can make a switch. Take the methyl folate. It is the most active form of folic acid and is highly needed prenatally. That is, before you try to get pregnant. You need it, and after you get pregnant. You see how this neural tube defect happens. Sometimes you're pregnant, you don't even know. And assuming that you are not taking any methyl folate or folic acid, this neural tube defect, your baby might fall a victim to it, okay? Because you don't know. We need it at the earliest, even before you start to show symptoms that you're pregnant. The methyl folate form should be actively waiting in your body. Like, you should have enough for yourself and then for your baby, all right? Then let's look at what a pro doctor said.
The problem I have is that some of you are falling pregnant. You're acting as if pregnancy is a surprise. My problem is there are some things you need to do before you even get pregnant. It's called prenatal care. And one of the most important things that you should do is to make sure that before you get pregnant, that you're taking your folic acid daily. Because folic acid is very important in the development of the baby's brain, especially in that very...
All right, not like I'm here to say anybody is wrong or right. I just want us to put things in proper perspective, especially for those of my ladies that maybe you know to go school like that, you know to understand some of all these medical jargons. Where do you stay? Like, where do you see yourself? Are you going to be getting more confused? Aproko doctor is saying that prenatal supplementation of folic acid is highly needed. It is highly needed. Like I said it earlier, before you get pregnant, you should have enough for yourself and for your baby, okay? All of the cell repair that I said earlier, you need it. Sometimes what you're struggling with is that you have too much of old cells, dead cells present in your system without sufficiently being repaired, taken down, okay? You will be struggling with inflammation. The womb will not be in the right atmosphere. Likewise, the fallopian tube. Yes. Likewise, the ovaries and your general well-being, girl. Very, very important, okay? So let's look at some of the supplements the nurse recommended, okay? And to be fair, she didn't really say why you need those supplements, but I'm going to be telling you why you need them, all right?
Listen, there are some important fertility medication that is very, very necessary. And all of them boils down to what? Boosting the quality of your egg. And that is what is more important. Number one of them is what? CQ10, which is what? Your coenzyme. Listen.
All right. The CoQ10 is highly needed, especially for women in their 30s, because it helps to power the mitochondria part of your cell. That is the egg inside. Sometimes the egg you're producing is too weak. The CoQ10 helps it to get strength, okay? It equally supports hormone balance. Amazing. Omega-3 fatty acid, on the other hand, reduces inflammation. When we say inflammation, so many times you don't understand it. Your fallopian tube might be inflamed. You don't know it. With omega-3 fatty acid, you bring it down. The tissues, the cells might be inflamed. With omega-3 fatty acid, you bring it down, okay? Then when it comes to NAC, when is highly recommended for women that are struggling to ovulate, and that is in polycystic ovarian syndrome women. That is, they have lots and lots of cysts on their ovaries. With NAC, it supports good hormone balance. That woman is able to produce right quality egg, okay? Then vitamin E is equally an antioxidant, okay? An antioxidant helps fight free radical generation. What does it mean? It simply means things that are going against your plan to get pregnant internally. Vitamin E helps to fight it, all right? So the balance here should be, should you completely neglect folic acid, or should you take all of these supplements at once, okay? The reason why we're even talking about supplements is because many of us are not getting enough, or we have poor absorption issues, or we are not eating what we are meant to eat. So supplement becomes handy, okay? In the methylfolate, you can replace that folic acid with methylfolate because it is in the natural form. The folic acid is highly synthetic. Like I said, because of that highly synthetic it has to go lots and lots of conversion before the active form emerges, okay? So you can replace it with the methylfolate, which is the active form, natural state. Because the truth is that your fertility supplement needs, they are determined by your medical personnel, your doctor, your fertility doctor, your gynecologist seeing you, okay? They determine because they have examined you. They must have run some tests and know where you are in your fertility needs before they do their prescription, okay? So very, very important. You don't just jump into taking those medications without accurate and proper diagnosis made. What exactly are you struggling with? Is it polycystic ovarian syndrome? Is it hormonal imbalance that has nothing to do with PCOS? Does it have to do with fibroid? Does it have to do with overstress, insulin resistance? These things determine the kind of supplements you are going to be taking, okay? The kind of fertility medications you will be taking. Then when it comes to you actually want to analyze which one will I not take in all of this, okay? You will not take out the folic acid entirely, okay? The methylfolate is there. And with the NAC, the omega-3 fatty acid, the vitamin E, the CoQ10, they work together. It's a synergetic effort. It's not a one-man show, okay? None of these supplements is running a one-man show. It is a synergetic effort. So they work together to give you the best optimum results. As long as you are taking it how you are recommended and doing every other thing there, okay? Sometimes some women are just prescribed omega-3 fatty acid and a vitamin E, boom, they get pregnant. Sometimes it takes the whole entire 4 before they get pregnant. So it depends on your fertility need, which must be ascertained by whoever, the medical personnel that is seeing you. Very, very important, especially your gynecologist, your fertility doctor. Very, very important. Let me know in the comment section if you're still confused, you have questions, concerns. Go ahead, let me know in the comment section. Like I said, I am not here to condemn any of the videos. I am here to throw more light and shed more understanding in this journey. He wish above all things that you and I prosper and be in amazing health, even as our soul prosperous. Thank you for tuning in today. Girl, I'm routing for you. If it didn't happen this week, certainly next week is there, next month is there. So let's keep going. Don't lose hope. Bye-bye and see you in the other side of victory.